Despite the legal setback, we are still expecting large demonstrations during the DNC.
Dr. Amit Gupta, emergency room physician and toxicology expert with Loyola Medicine, joins us now live to discuss some safety tips for protesters and convention attendees or people who may get caught in all of it. Dr. Gupta, thanks for being with us. First of all, whenever you see a huge gathering like this, it can quickly go from orderly to disorderly, right?
Correct. Yeah, it can, in a blink of an eye, it can get chaotic without any notice.
So how do you suggest people who are participating take some steps in advance just in case things get out of control?
Yeah, as you can imagine, it's just being really prepared. You know, I actually haven't looked at the weather, but the weather's going to be like, but obviously wear loose clothing, but not too loose that can get snagged on stuff. Bring any kind of first aid kit, any emergency medication that you might need. If you have any severe allergies, maybe like an EpiPen or Benadryl. And just have plenty of water. We usually recommend like squirt bottles for water. In case you do get like some kind of chemical sprayed on you, it's very easy to wash it off with a squirt bottle. Don't wear contact lens. That's a big thing we always stress, because if you do get a chemical on you and it does get into your eye, the contact lens can kind of trap in the chemicals from either pepper spray or tear gas. And so wear like eyeglasses or goggles if possible. And we have seen a spike in COVID in this past summer, the past month or so. So if you need to wear a mask, an N95 mask or any kind of cloth mask to help spread transmission, that might be also helpful.
So it's a lot to remember. I do want to ask you how hospitals have been preparing for this, because this is a bit different than, let's say, you know, Lollapalooza and the thousands of people that we get for that big event. Obviously, hospitals have to do something a little bit different in this case. So how do you prepare?
I think it's just about staffing, having the staff ready, having enough nurses, physicians, technicians, just having people on call in case there is a mass disaster plan, you know, that mass disaster event and multiple patients coming in. And we have triage systems in place where patients that aren't as critical, you know, have a special treatment area as patients that are more critical that need to be seen and treated first.
I think some people might be surprised to learn that hospitals actually drill for these types of events regularly.
Yeah, we do these drills annually, and especially when we have big events like this, it is reiterized to us.
That's good to hear. I know one of the big concerns for folks is, you know, if these crowds, if they get out of control or there's tear gas or pepper spray, you know, how do you handle a situation like that? I think that's the #1 question that people sometimes bring up. So what's the advice for something like that? Let's say it's tear gas or pepper spray. What should they do?
Of course, yeah, that's the most important question. So luckily, you know, we do have layers, clothes that help block off a lot of exposure. So we do recommend removing clothes. Sometimes just removing clothes removes 70% of the chemicals that you're being exposed to. And just simple washing with soap and water. And you can probably eliminate more than 90% with just removing clothes and soap and water.
I got tear gassed covering the protests up in Minneapolis a few years ago, and some people were dumping milk on their eyes afterward. Does that work, or is that a wives' tale?
No, it works. It traps the chemical, the chemical in pepper spray, capsaicin, which is found in like chili peppers. So it actually does work. Sometimes we question the sterility of the milk. You know, if it's been sitting out for a little bit.
True. Yeah.
I don't know if you want coagulated milk in your eyes, but something that's a little bit more sterile, and also people usually have it available in their home at least, is just like antacids, like Maalox is a very simple one.
Okay.
But milk works. Also,
I was listening to one safety session where they said, bring lip balm and a bandana. I imagine the bandanas in case there's any kind of injuries.
Yeah, I think the bandana is a good idea, and it also like helps prevent transmission of some viruses also. So not a bad idea.
All right, thank you.
Let's hope everything stays calm and you don't need to be dumping milk on your face.
Fingers crossed. Okay, thank you, sir.
Thank you, doctor. And